actually standing just across the street from Crossroads. It's an organization that helps those with mental illnesses, and they tell me that because of funding cuts in the last 2 years, they've had to reduce the number of people they help by 50%. That's 50%. Now, the umbrella of public mental health here in Michigan also includes those struggling with addictions and those who have physical and intellectual or developmental disabilities. And so there are some families, one family in particular I spoke with, that is really getting hit hard by the funding cuts.
Gracie gets really bored.
14-year-old Ben Zens has come a long way.
Put him in the bucket.
Thanks in part to the dedication of his aide, Mary, who's been by his family's side for 10 years.
Yay, you did it! You did your pegs! You did your pegs! Good
Ben suffered severe brain damage as a result of abuse as an infant,
which left him blind, unable to speak, unable to feed himself, walk, take care of himself in any way.
Then Debbie Zens and her husband adopted him.
We got him actually through hospice, through the state. They never expected Ben to survive.
Thanks to support and services through Medicare and Macomb County, the Zens family has had a lot of help in taking care of Ben.
I physically have some health issues that I cannot lift Ben. He's over 100 pounds.
So an in-home aid has been crucial for things like showering, changing his clothes, getting him in and out of the wheelchair. They're all impossible for Debbie without help. Yesterday, she got a notice in the mail that in 2 weeks, the help she's relied on for more than a decade will no longer be available.
Our services were reduced by 67%. That's not a reduction. That's almost eliminating our services. But now I feel like we've lost that support that we really needed in order to make this happen, and I don't know how we can do it without it.
Ben, can you say goodbye?
Now, Ben is getting older, and with every year, he's also getting a lot heavier. So just doing the basic things that most of us take for granted, well, it's a scary thought for Debbie, knowing that she won't have an aide there to help her. She's not sure how she's going to do it, and many other families are in the same boat. Meanwhile, in Macomb County, the man who's in charge of the mental health department says he's spending several days a week in Lansing lobbying to get some of that lost funding back, so some of these services and support can be restored. Reporting live in Macomb County, I'm Jennifer Ann Wilson. Back to you.
So Jennifer Ann, is there anything that the family can do to fight back and even get their money?
Yeah, so the families can all appeal. There are 2 steps to the appeal process. They can appeal to the county, but at this point the county doesn't have extra money. And so if that appeal gets denied, they can appeal again to Medicaid or Medicare, wherever they're getting their support, and try to get those services reinstated. So far, the Zens family says that they know other families who received their letters with similar news within the last couple of months, and they don't know anyone who's had their appeal approved as of yet, but they are hopeful that their appeal will be approved so they can continue getting some of that funding. It's a tough spot, though, a lot of these families are in right now.
Yeah, it definitely is for sure. A lot of cuts affecting a lot of families. Jennifer Ann, thank you for that live report.